for her to do so. And as this hearing is starting, the Senate is preparing to go into session to vote on the rescissions that the Republicans want to make to the Corporation for Public Broadcasting, to the national public radio system in our country, to public television system in our country. They want to slash all of the federal funding. And so we're going to be having huge debates today on all of those issues that go actually to the core of what our country should stand for. And the senators and House members will be arriving, you know, in a fashion that reflects the incredible set of important debates going on the House and Senate floor as we'll be doing this. But we're going to be joined by many House and Senate members. So we thank all of you for joining us for this spotlight hearing. A right at risk, protecting the right of contraception and reproductive freedom in the post-Roe era. Thank you to Congresswoman Fletcher for co-hosting this event, and thank you to our witnesses for your courage, your expertise, and your commitment to reproductive freedom for all. Today we gather to confront a growing crisis, one that's unfolding quietly but dangerously across our country. It is the escalating assault on the right to reproductive freedom. Republicans and extremists have attacked abortion, and now they're ramping up the fight on contraception. When the Supreme Court overturned Roe versus Wade, they didn't just strip away a fundamental right to abortion. As Justice Clarence Thomas made clear, the court cracked open the constitutional foundation protecting all reproductive freedoms, including the right to birth control, such as IUDs and Plan B. And now, in the 2 years since Dobbs, we've seen that warning turn into reality. As detailed by the National Women's Law Center's report published this April, right-wing extremists have turned to the anti-abortion strategy of chipping away at the right of contraception through misinformation, manipulation, and targeted restrictions that are tantamount to a ban. MAGA extremists are cutting off funding for Planned Parenthood and shutting down clinics across the country where people can get contraception, slashing Medicaid and the Affordable Care Act, making health care harder to get, pursuing a legal strategy from state courts to the Supreme Court to make it harder for people to get contraception. And they are redefining emergency contraception, such as Plan B, as abortion, hoping to sow confusion and restrict access through fear and through stigma. So let's be clear. These are not isolated efforts. This is a calculated, coordinated, and insidious campaign to make birth control harder to access. Republicans have blocked the passage of my Right to Contraception Act in the Senate with Senators Hirono and Duckworth and Congresswoman Fletcher. Not once, not twice, but 3 times. Blocked it in the Senate. In states like Virginia and Nevada, Republican governors have vetoed state versions of the Right to Contraception Act. In Alabama, Arkansas, Iowa, Idaho, Kentucky, Missouri, Tennessee, and Wyoming, elected officials have either proposed or passed laws that make it harder to get contraception. Republicans are against abortion, yet they are restricting access to birth control to prevent the need for an abortion. That's like banning umbrellas when you don't want rain. Here's what the American people need to know. This is not just about birth control pills or IUDs. This is about health. This is about freedom. Freedom to live your life with dignity, autonomy, and control over your health, your family's future. The Right to Contraception Act would enshrine that freedom into federal law. It would guarantee access to contraception, protect providers from political interference, and ensure that no one, no matter their age or income or zip code, is denied the care which they need. Today's hearing is about raising the alarm and shining a spotlight onto why we need to protect that right. The Republican agenda in an era where they have just passed the biggest health care cuts in the history of the United States of America, the biggest cuts ever, are supercharging discrimination, taking people's health care choices away and cutting people off from care is not pro-life or pro-family. It is an abdication of their responsibility to the American people and a cynical sellout of families and freedom. We cannot allow MAGA to roll back decades of progress, and we will not stop until the right to contraception and reproductive freedom is protected for everyone, everywhere in our country. So that is what today's discussion is going to be all about. And we're going to have an incredible panel who will look at every single aspect of this issue so that the American people can hear what it is that is taking place in their name here in Washington and across the country. Our first witness is Dr. Tracy Wilkinson. Dr. Wilkinson is an associate professor of pediatric and obstetrics and gynecology at Indiana University School of Medicine. As a health services researcher, her work focuses on reproductive health care access, especially for adolescents and young adults. Her current projects include the Path for You program, that is a statewide contraception access initiative in Indiana, and the Patch project that trains pharmacists to prescribe birth control directly to patients. She graduated from Vanderbilt University School of Medicine and completed her pediatric residency at Brown University and Hasbro Children's Hospital in Providence, Rhode Island. Dr. Wilkinson, whenever you're ready, you may proceed with your testimony.
Thank you, Senator Markey. Thank you for the opportunity to speak with you today about birth control access and the growing threats posed by misinformation and restrictive policy.
Could you move the microphone over just a little bit right in front of you, if that's possible?
Sure if it's on.
Okay, if you push that button.
Oh, there we go.
Beautiful.
It just went off. Okay, there we go. As you heard, I'm an associate professor of pediatrics and hold a joint appointment in the Department of OBGYN at Indiana University School of Medicine. But I'm speaking on behalf of myself and my patients today. As a general pediatrician, I care for patients across the full range of pediatrics. But the best part of my job is listening, easing fears, answering questions, and connecting young people with the information and resources they need to make informed choices about their health and futures, including if and when to become parents. Earlier this month, I had a teenage patient who wanted birth control so she could focus on finishing her education. We discussed what mattered to her in a method, and she learned about options she hadn't even known were available. With access to the full range of choices, she was able to choose what worked best for her and have autonomy over her future. For decades, birth control has been one of the safest, most effective, and widely used tools to support reproductive autonomy and improve maternal and infant outcomes. Yet it's increasingly under attack through policies rooted in ideology rather than science, and through misinformation that misrepresents how contraception works. These attacks are not about patient safety or public health. They are about control. And because of the broad popularity of contraception, they are designed to be less noticeable. These attacks are supported by the landscape of anti-abortion groups who oppose not just particular types of contraception, but all hormonal contraception. Legislators at the state and federal level have introduced legislation that misrepresents how certain methods of birth control work, falsely claiming that they cause abortions or excluding forms of contraception from coverage. Let me be clear. These methods prevent pregnancy. They do not end it, but these falsehoods are being used to justify carving them out of programs, restricting access, and confusing the public. For example, last year, Indiana passed HEA 1426 to expand access to long-acting contraception in the postpartum period. But under pressure from anti-abortion groups, intrauterine devices were excluded based on the false claim that they cause abortions. In reality, IUDs prevent pregnancy. This exclusion of one of the most common postpartum methods created so much confusion that our state medical association had to issue a clarifying statement affirming that IUDs remained legal and were not banned. These attacks continued this year with House Bill 1169. Though framed as expanding access to birth control based on income, it excluded condoms and long-acting forms of birth control and was ultimately amended to focus only on fertility awareness education. This defies public health logic and further stigmatizes proven tools for preventing unintended pregnancy and sexually transmitted infections. We should support patient choice and provide clear evidence-based information on all contraceptive options, not move away from science-driven policy. Through our statewide contraceptive access initiative called Path for You, we've seen how patient-centered community-based contraceptive care can improve access and change lives. This is the type of access that we should be expanding and guaranteeing for everyone who desires care, not restricting. Simultaneously, our communities are also experiencing the largest cuts to Medicaid in history at both the state and federal level, which is the primary source of reproductive health care for so many individuals. When Medicaid is weakened, it's not just a policy issue, it's a direct hit to birth control access for people who already face multiple barriers to care. As a pediatrician, I worry most about my adolescent patients who need confidential, compassionate, and timely access to contraception. Too often, they face stigma, misinformation, and barriers that delay care. These are the young people that are left behind by ideologically driven policies, crafted by those who will never sit across from them in clinic, who will never hear the fear in their voices or see their futures narrowed because they couldn't get the care that they deserved. Let me be clear, there is no controversy in the exam room. Patients want information about birth control. They ask for it, they rely on it to manage their health and their lives, and many use it for reasons beyond pregnancy prevention, like heavy bleeding or irregular periods. What's truly controversial is how far policy has strayed from the people it's meant to serve. We have the evidence. We know what works, and yet we are in danger of losing access, not because of the lack of science, but because of politics, disinformation, and ideology creeping into medical decisions and policy making. Every person deserves the right to decide if, when, and how to become a parent. Birth control makes that possible. As a physician, I urge you to protect that right, protect birth control, and empower those who depend on it. Thank you.
Beautiful. Thank you, Doctor, so much. Next, we're going to hear from Ms. Terrina Keane. And for the last 17 years, Ms. Keane has led Repro Rising Virginia, formerly NARAL Pro-Choice Virginia, as the organization's executive director. Under her leadership, the organization has led historic advances for reproductive freedom for Virginians. She helped lead the passage of Virginia's Reproductive Health Protection Act in 2020, an act that overturned decades of egregious barriers to abortion care, making Virginia a central access point for reproductive health care in the South in the post-Roe era. She has a BA in both media studies and political science from Radford University and a master's of public administration and nonprofit management from Old Dominion University. Whenever you feel comfortable, please begin.
Thank you. Thank you, Senator Markey. Good afternoon. Again,
Move the microphone in just a little closer.
Thank you. All right. Again, my name is Terrina Keane, and I am the Executive Director of Repro Rising Virginia. We are a state-based reproductive rights and freedom organization, advocacy organization in the Commonwealth of Virginia. And it is our mission to ensure that people have the ability to decide if, when, how, and with whom to start and grow their families free from political intrusion. I am honored to provide testimony before you today regarding issues surrounding contraception in the Commonwealth. Access to birth control is supported by the vast majority of Virginians, and the Commonwealth has adopted policies to reflect this stance. First, the Virginia Department of Health offers 2 free family planning programs. Plan First and the Contraceptive Access Initiative that benefit people with lower incomes, both Medicaid eligible and those without coverage. I would like to note that it is unclear how these important programs will be affected by the recent passage of the reconciliation bill. Furthermore, Virginia is one of 23 states that allows for 12 months of birth control pills to be dispensed at one time. This makes it easier for people who can become pregnant to time and plan their pregnancies and not find themselves without this time-sensitive medication. Even with these progressive and bipartisan contraceptive policy advances, some people, including rural, young, lower income, and people of color, still struggle to consistently access contraceptive care. Specifically, the method that is right for them at the time that is right for them. These policies and laws are clearly not enough, and we as advocates have been trying to do more. However, we continue to be stymied by our anti-reproductive freedom governor. Since 2023, the Contraceptive Equity Act has been introduced 3 times in the Virginia General Assembly and passed twice. The bill would codify the no copay mandate in the ACA and expand access to contraception beyond pregnancy prevention and increase method options. In 2024 and 25, Virginia introduced its own right to contraception bill alongside the equity bill to further solidify Virginians' rights and access to birth control. Both bills passed the General Assembly with bipartisan support, yet Governor Glenn Youngkin vetoed both bills, not once, but twice. Each year, Governor Youngkin devised different reasons for vetoing the bills, but his excuse this year was quite telling. Most recently, the governor's substitute claimed that Americans already have the right to contraception under the Supreme Court's Griswold and Eisenstadt decisions, which legalize contraception for married and non-married people. However, we know that the cover of favorable decisions from the Supreme Court is insufficient. The court's overturning of Roe not only was a devastating blow to reproductive freedom, but a foreboding threat to the other rights the court had previously acknowledged as guaranteed by the Constitution. Justice Thomas wrote in his concurring opinion in Dobbs that the court should reconsider previous decisions such as Griswold, which makes it abundantly clear that Governor Youngkin's assurances should be of little comfort. Governor Youngkin also introduced a conscientious objection as a mechanism to justify anyone's right and ability to deny someone birth control for any reason. This would add Virginia to the list of 7 states that already allow pharmacists to refuse to dispense birth control and would undeniably further restrict, not expand, Virginians' access to contraception. There is no doubt that Governor Youngkin and Lieutenant Governor Winsome Sears, who is currently running for governor and cast a tie-breaking vote in opposition of the right to contraception bill, oppose the right and access to birth control. Governor Youngkin was trying to take a politically safe stance with his amendment, while also allowing the door to open for the Supreme Court to rescind these rights. But he is playing a dangerous game with people's lives and futures. Access to contraception is essential to reproductive health care and gender equity. Contraception is not merely a matter of personal choice, it is health care, and access to this health care has a large and positive impact on maternal and infant health outcomes, economic stability, and prosperous, safe communities. Nonetheless, the advances we have made in a purple state like Virginia are clearly precarious. And if a state like Virginia can't rely on its own government to protect and advance its right to contraception, then surely other state governments, ones that are openly attacking reproductive rights, cannot be expected to do the same. This is why it is critical of our lawmakers in Congress to take decisive action to enshrine this crucial right and to expand access to birth control. We need laws that codify the right to birth control, prevent pharmacists from refusing to dispense birth control, and requiring health insurance to pay for birth control. Repro Rising Virginia, along with our advocacy and legislative partners, we're not giving up. We will reintroduce both the equity bill and the rights bill in 2026. But furthermore, we are working to pass the Virginia Constitutional Amendment for Reproductive Freedom that would protect birth control, abortion, and the full range of reproductive health care. Our research shows that well over 60% of Virginians support enshrining these rights in the state constitution. Virginia reproductive freedom advocates also know that we have the support of our fellow Virginians to get it done, but we are also keenly aware that our rights can be taken away at the federal level and make our hard-fought liberties null and void. We are counting on you to also keep fighting for justice. And I want to thank you again for sponsoring and supporting bills like the Right to Contraception Act, the Access to Birth Control Act, and the Affordability is Access Act. So please continue to fight for our fundamental human right to be able to decide if or when to become pregnant. With more than 90% of Americans supporting birth control and using it during their reproductive years, they are counting on you. Thank you.
Thank you so much. Our next witness is Ms. Lucy Arvayo. Ms. Arvayo is the Executive Director of Jane's Due Process in Texas. Ms. Arvayo received her bachelor's degree from St. Edward's University and graduated with honors from St. Mary's University School of Law. And after graduation, Lucy joined If, When, How as a reproductive justice legal fellow. And most recently, she served as senior policy analyst at the National Latina Institutes for Reproductive Justice, leading the Immigrant Access to Healthcare and Coverage portfolio. She is also a board member for ARC Southeast, an organization that provides funding and logistical support to ensure Southerners receive safe and compassionate reproductive care, including abortion services. Ms. Arvayo, whenever you're comfortable, please begin.
Thank you so much, Senator. And to the members of this hearing, thank you for the opportunity to speak today. Again, my name is Lucy Arvayo. I use she, her pronouns, and I am the Executive Director at Jane's Due Process. I work directly with young people across Texas, one of the largest and most diverse states in the nation, but also one where birth control is constantly under threat. I've met countless young people, high school students, college freshmen, and young mothers under 18 who are navigating their reproductive health without the resources or support they deserve. For many of the people we serve, birth control is not just about preventing pregnancy. It's about managing health conditions, staying in school, keeping a job, and making their own decisions about their future. That is why I'm here today, to urge Congress to take action to protect young people's access to the full spectrum of reproductive health care without political interference, because their health, autonomy, and futures depend on it. Jane's Due Process has helped young Texans access reproductive health care for almost 25 years. We are the only abortion fund in the country that focuses exclusively on helping young people access the full spectrum of reproductive health care, including abortion, birth control, sex education, and pregnancy care for young mothers. And that is because we recognize the unique and complex barriers young people face when accessing this care. We operate a hotline text line that young people can access 7 days a week to answer questions and navigate resources around contraception and STI testing and treatment. And we hear every day from young people who ask questions they are too afraid to ask anywhere else. These are young people like H.K. Gray, our incredible youth fellow coordinator and former JDP client. H.K. gave permission to share her story that highlights exactly what this looks like for young people on the ground in Texas. I'm honored to share her story with you on her behalf. H.K. says, in 2017, I was a brand new teen mom and had found myself pregnant again. Months prior, I was unable to get the birth control that both my doctor and I agreed was the best fit for me because I was a de facto orphan who couldn't get written parental consent. I knew I wanted to have an abortion, and I went through a lengthy judicial bypass process with the help of JDP in order to finally be able to consent to my own procedure. After all of that, I didn't even have half of what it cost to have an abortion. The longer the judicial bypass took, the more expensive my procedure became, and by the end of it all, I just didn't have enough money saved to afford an abortion. If it wasn't for JDP and the Texas Equal Access Fund coming together to pay for it, I would have been forced to carry that pregnancy to term. This would have drastically reduced the quality of life I was providing for my daughter and brought us under the poverty line all before I reached the age of 18. I should have had access to birth control and abortion care in my community, but instead they left me to figure it out on my own. The legal landscape around contraception for young people has only been further complicated since HK was denied birth control. In 1998, Texas passed a law requiring people under the age of 18 to get a parent or guardian's consent to access FDA-approved contraceptives, including the birth control pill. In 2022, the Fifth Circuit further limited that access through the Deanda versus Becerra decision, which prevents young people from accessing prescription contraception from a Title X clinic without parental consent. The only state to do so despite decades of protected federal provision. These barriers, combined with the existing landscape of extreme abortion restrictions and abstinence-first education mandates, creates a system that is nearly impossible for young people to navigate when seeking access to information and resources on contraception, pregnancy, and abortion care. One thing is very clear in our work in Texas: young people are confused, embarrassed, and even scared when it comes to accessing contraception, and it's on us to fix that. A survey we conducted with Penta found that while 77% of respondents reported that information on their reproductive rights are important to them, only 49% reported understanding what those rights were. Fewer than 1 in 3 teens reported being confident in their ability to get information on reproductive care or in their understanding of what options were even available. Feelings of shame, embarrassment, and privacy concerns are top barriers that prevent teens from seeking information and care, with 63% of young people reporting they wanted information but did not ask because of these concerns, and another 40% saying the same about their fear of parental involvement. While a majority of our clients do choose to involve their parents in their healthcare decisions, the most vulnerable young people do not have that choice. Young people experiencing family violence, separated but not emancipated from their parents, or living in unsupportive family units are often disregarded in mandatory parental involvement laws. A 2022 study of sexually active Texas minors seeking contraception found that many wanted to use a highly effective method to prevent pregnancy, such as hormonal birth control, but were unable to involve a parent to obtain care. The Texas Policy Evaluation Project found young people subjected to mandatory parental consent laws for clinician-provided contraception are more likely to stop seeking care and rely on less effective contraceptive methods or no method at all. As a result, they face a higher risk of unplanned pregnancy, forced birth, and negative health outcomes. Even when young people have parental support, confidential access remains crucial to empowering them in choosing their contraceptive method and taking an active role in accessing services that impact their future reproductive health. What happens in Texas does not stay in Texas. Our policies are often used as a blueprint for extremist state lawmakers all across the country as a part of a coordinated effort to undermine the reproductive rights of every young person in the country. Young people are often used as a litmus test to determine what restrictions can be pushed everywhere for everybody, and attacks on birth control are no different. No one should be denied access to necessary reproductive care, including contraception, because of their age or zip code. We need protections that guarantee every person has access to the full range of reproductive health care, including birth control. Anything less is a failure to protect the health and autonomy of the next generation. Thank you for your time today and for allowing me the opportunity to share the experiences of Texans here with you today. I look forward to your questions.
And thank you so much for your testimony. And the next witness is Ms. Nicole Kle. Joining the organization 12 years ago, Ms. Kle currently serves as the president and CEO of Planned Parenthood of Northern New England. Nicole has been on the front lines of the fight for reproductive rights and freedoms for more than 2 decades. Under her leadership, the organization has played an integral role in the passage of more than a dozen pieces of legislation, several of which have dramatically improved access to abortion and sexual and reproductive health care. She led the development of a scientifically proven abortion persuasion campaign, which has been replicated across the country. And she permanently stepped into the role of president and CEO last September, and over the past year has provided real leadership during unprecedented times. Ms. Kle, thank you for being here today, and you may proceed.
Good afternoon. Thank you, Senator Markey and Representative Fletcher, for having me here. There we go. Okay. Sorry about that. Good afternoon. Thank you, Senator Markey and Representative Fletcher, for having me here today to speak about the attacks on birth control and the critical role of Planned Parenthood health centers. My name is Nicole Kle, and I am the CEO of Planned Parenthood of Northern New England, which serves more than 32,000 patients annually through 14 health centers across Maine, New Hampshire, and Vermont. Contraception is a key component of reproductive health care. The decision about whether, when, or how to become a parent is one of the most important life decisions we make. Contraceptives can also help alleviate symptoms of debilitating periods, prevent the risk of cysts, and lessen risk of endometrial and ovarian cancers. Birth control is essential health care. Access to it is necessary and popular. Nearly 9 in 10 women of reproductive age have used birth control, and nearly 9 in 10 adults agree that everyone deserves access to the full range of birth control methods, no matter who they are, where they live, or their income. Last year, Planned Parenthood members nationwide provided 2.2 million birth control services to patients. Today, family planning providers are navigating increased demand for services following the Dobbs decision and the election of President Donald Trump. To be clear, our patients are worried that politicians and judges, not their trusted medical providers, are deciding whether they can access birth control that is right for their needs. Their concerns are valid. We knew opponents were never going to stop at overturning Roe, and this month we saw the latest attack on reproductive health care become law. As you know, Republicans in Congress passed President Trump's reconciliation bill to defund Planned Parenthood by prohibiting certain member organizations from receiving reimbursements for the non-abortion sexual and reproductive health services we provide to Medicaid patients, just as other providers do. This policy is devastating for our patients. For many, we have been their trusted provider for years, even decades. They have disclosed trauma and sexual assault. They have sought help because their relationship is unsafe. We have held their hands when they suffered a miscarriage. We have connected them with specialists when we suspected cancer. We have provided them with the birth control method that is best for them. And we have listened without judgment and offered some of the best care a patient can receive in this country. The most recent attack is part of their long-term goal to shut down Planned Parenthood health centers and ban abortion nationwide. Nearly 200 Planned Parenthood health centers in 24 states are at risk of closure, the vast majority in states where abortion is protected and legal. President Trump and his backers in Congress are putting patients' health care at risk, including more than 8,000 patients in Maine, New Hampshire, and Vermont. 70 million Americans rely on Medicaid for health insurance, including more than 1.1 million Planned Parenthood patients. More than half of Planned Parenthood health center patients rely on Medicaid. Prohibiting Planned Parenthood health centers from participating in Medicaid will hurt our patients and is expected to cost taxpayers more than $50 million, according to the Congressional Budget Office. Not every healthcare provider accepts Medicaid, but Planned Parenthood does. And we are proud to provide care to all, regardless of a patient's ability to pay. Across this country, Planned Parenthood is sometimes the first and only healthcare provider patients see in the entire year. There is no other provider who can step in and replace the essential life-saving healthcare services we provide. We operate in a healthcare system that does not adequately reimburse us for the care we offer. The reconciliation bill, coupled with the Trump administration's decision to withhold already appropriated Title X family planning funds, means our organization is facing a loss of $5 million this year. This is not something we can sustain. So far, in 2025, at least 20 Planned Parenthood health centers across 7 states have closed or announced plans to close. Planned Parenthood of Northern New England has been forced to close a total of 6 health centers since 2022. And the impacts of those closures are still felt in those communities years later as we navigate continued gaps in care. If we are forced to close additional health centers, it would have devastating ripple effects on our already fragile healthcare system, leading to longer wait times and increased costs for everyone, not just Medicaid patients. People in rural states face unique barriers, and they already travel far distances to get the essential care they need. This will only get worse. Over 60% of Planned Parenthood health centers are located in medically underserved areas. In New England, where it can take hours to reach a healthcare provider, We are seeing rural hospitals and providers close at alarming rates. We need champions in Congress to continue fighting alongside us. So thank you for holding this hearing, and we look forward to your questions.
Thank you so much. Thank you for your testimony. And our final witness is Ms. Taylor St. Germain. Ms. St. Germain is the Deputy Director of Reproductive Equity Now. She joined the organization in February of 2022 as the Communications Director and has since helped pass Massachusetts post-Dobbs Shield Law, the Commonwealth's latest maternal health package, and helped guide the organization's expansion into New Hampshire and Connecticut. So she has been giving leadership in New England on these issues with her organization. I know her well. She was my press secretary on my staff, and so she was a great loss to me on my staff, but an incredible advance for the cause of reproductive equity in New England and across our country. So we welcome you. Whenever you feel comfortable, please begin.
Thank you, Senator Markey. Good evening, or good afternoon. It's not evening yet. I would like to start today by thanking
Is
Senator...
the microphone on?
Oh, is it? Can you hear me now?
Okay, beautiful.
Okay. By thanking Senator Markey and Representative Fletcher for convening today's critical and timely spotlight hearing, and to the members here with us today for strategizing with us on how we can protect access to care. I'm honored to be here alongside my fellow witnesses and partners in this fight. And lastly, I'd like to extend a special gratitude to the National Women's Law Center for authoring the eye-opening report that inspired today's hearing. My name is Taylor St. Germain, and I'm the Deputy Director of Reproductive Equity Now, a New England-based organization working across Massachusetts, Connecticut, and New Hampshire to make equitable access to the full spectrum of reproductive health care a reality for all people. Much of our work does center around defending abortion access, which we know remains relentlessly under attack. But as you've heard from other witnesses today, Trump and his anti-abortion friends are not satisfied with only stripping away access to abortion care. They are coming for contraception, too. Access to contraception is a fundamental part of reproductive health care and a critical tool for ensuring that people can decide if, when, and how to start or grow their families. We've already heard a lot from my fellow panelists about attacks that we are seeing across the country. I want to share a little bit about our experience working in New England, a region of primarily protected states, where we're grateful that an overwhelming majority of our leaders support access to contraception and reproductive health care. But even here, we still feel the impacts of these national attacks. And more than that, we do feel a responsibility to push back and meet these threats head on with state-level policies to ensure that care is available, affordable, and accessible to everyone who needs it. When Donald Trump first threatened the Affordable Care Act's contraceptive mandate in 2017, Massachusetts stepped up, passing the Contraceptive Access Law, which required state-regulated health plans to cover contraception at no cost to the consumer. This law also guaranteed patients could get up to a year's supply of birth control at once. I want to note Connecticut and New Hampshire have passed similar laws. This has been a lifeline for students, for low-income and rural communities, or anyone who needs reliable, affordable, and uninterrupted care. Massachusetts didn't stop there. In 2022, the Department of Public Health issued a statewide standing order for emergency contraception, clarifying that people may use their insurance to cover medications like Plan B or Ella at the pharmacy counter, no prescription required. Early results show that this has had a big impact. We have seen emergency contraception fills increase by over 30% in the first year alone. And since the Dobbs decision, as our clinics across our region have seen a significant increase in patient volume, placing growing pressure on already stretched systems. States like Massachusetts and Connecticut have responded by authorizing pharmacists to prescribe and dispense birth control directly to patients with no doctor's visit required. This simple change removes major barriers to care, especially for people who can't afford to take time off of work, face delays in getting an appointment, or may struggle to find a provider at all. We also know that protecting young people's confidentiality is critical. If teens fear their privacy won't be respected, they may skip care altogether, putting their health, their education, and their futures at risk. This past legislative session, we did see anti-repro policymakers in New Hampshire attempt to end confidential reproductive health care for minors. But we know that contraception access is popular, and when faced with lots of community outrage, lawmakers were forced to drop this provision from the bill. Conversely, in Connecticut, where the right wasn't yet written into law, legislators acted proactively this year to make sure teens can access birth control and pregnancy-related care without being forced to disclose to a parent or a guardian. And yet, even with these safeguards in place, due to the attacks coming out of the Trump administration, there will be people in New England who will be unable to access birth control, providers' hands who will be tied, and funding gaps too deep and too wide for states to fill. We have to be realistic. State leadership alone cannot undo the damage that the Trump administration is causing. And with cuts to Medicaid, provisions to restrict funding to Planned Parenthood, and attacks on abortion providers, this latest reconciliation law is a backdoor ban on reproductive health care. It undercuts state protections and overrides states' ability to safeguard our rights. And the result is that patients and providers are stuck between a confusing patchwork of laws, with states trying to protect care in some cases and federal policies trying to block it. States with strong leadership will continue to step up with bold ideas and practical solutions, but they can't do it alone. When it came to Roe, we did wait too long to take decisive federal action to protect abortion care, and that delay cost us dearly. We cannot make the same mistake again when it comes to contraception. I'm here today to tell you that it is absolutely critical that Congress take action to pass the Right to Contraception Act. We have to use every available tool in our toolbox to protect and expand access to this essential, life-saving care before it's too late again. With that, I'd like to thank you all again for hosting today's Spotlight hearing, and I look forward to answering questions.
Beautiful. Thank you so much. Thank you for your testimony. And now I will pass it over to my partner from the House of Representatives, a stalwart defender of reproductive freedom in Texas and reproductive justice for our country. Congresswoman Fletcher, you are recognized.
Well, thank you so much. Senator Markey, thank you for your partnership. Thank you for your leadership. I'm so glad to work with you on these efforts and more. And I love, Taylor, that you finished your testimony with a comment about the Right to Contraception Act, which we introduced together and which everyone here supports and is so critical to the work ahead. And so I just want to thank you so much and thank all the members who have taken the time to gather here and participate in this, to our friends from the House and the Senate who are here, who are such leaders on this issue, which is why they're participating with us today. And of course, I want to thank our witnesses. I apologize that I was a little bit late coming from votes in the House. Always a little bit of a mystery how the schedule is going to work out, but I'm thrilled to be here and to hear from my fellow Texan, Lucy Arvayo, as well as to hear from all of you and to be here for your questions as we move forward. And I heard it in the testimony earlier, but it is true that Texas is unfortunately ground zero for the attacks on reproductive health care, for the attacks on reproductive freedom, and our ability and our right to make our own decisions about our families, our futures, our bodies. And one of the real challenges is that some of the very bad ideas from Texas's legislative efforts have been imported to Washington, D.C. We were just hearing a little bit about the efforts to defund Planned Parenthood in this most recent reconciliation bill, which despite all of our efforts, all of our votes against, all of our attempts to strip that from the bill, continued and unfortunately passed. And in Texas, Texas has been trying to do that for a long time, as many of you know, and we have seen the devastating impacts of what happens. Fewer people were able to access any kind of reproductive health care at all. We saw that unintended pregnancies and births went way up, and access to birth control went way down. And these are huge challenges for families across our state. And they're becoming the challenges for families across the country as Republicans in Washington take these ideas and run with them. And so it's not just in my home state of Texas, but across the country that women and families are in crisis. But certainly Texas is a cautionary tale of the kinds of things that we have seen happen and the attacks that we know are coming. And so that's why I'm just so grateful to all of our witnesses for being here to share your experiences, to share your insights, your recommendations, the things that we need to know as lawmakers, the things that we have to anticipate. You know, I feel like a lot of us, probably everybody in this room, has been mourning for decades. For me, for as long as I can remember, being as a teenager, hearing that that the Supreme Court, that there was a movement to undo Roe v. Wade, and people would just say, that will never happen. That will never happen. Nobody believed it. Well, it has happened. We've all seen it. We've seen the devastating impacts in Texas and states like it that have restricted access to abortion. We've also seen the states that have really made efforts to protect their citizens and to make sure that people have the full access to reproductive health care that is medically accurate, that's safe, that's affordable, and that's non-judgmental. And I think that that's so important. And I say that as a not just a Texan, but a former Planned Parenthood Gulf Coast board member, knowing how important that access is and how that is so under attack. And so I think it's really important that we take very seriously the challenges we now see on access to contraception, because again, you hear the same people saying, that would never happen. They're never going to take away birth control. It's just, no one would do that. Too many people use it. Too many people rely on it. And that's right. 90% of people rely on it. The vast majority of Americans support the Right to Contraception Act. But that, as we have seen, does not sway our colleagues on the other side of the aisle. Public sentiment was against this terrible, big, ugly bill by 2-1. And they came after all of these important programs and protections, and they'll continue to do more. So I think it is critically important that we continue to do the work in Congress of protecting people and protecting their right and their access to contraception. And so with that, I just want to thank you all for your participation. Thank everybody who's here today. I look forward to hearing your responses to the questions, and I'm so grateful to all of the wonderful members here who are participating and leading the way. Thank you.
Thank you, Congresswoman Fletcher, and thank you for your leadership. And we just have a great panel of witnesses, and the members are now arriving. And again, we've got a big traffic jam on the Senate floor. And
I'm about to go vote.
if you are not coming back, I would like to recognize you right now, if we could do that. Sure. Okay, so, and we apologize to you. We have the same problem over in the Senate right now. We're about to take up the rescission package, as you just had with your roll calls on the floor. So let me recognize, if you don't mind, let me recognize Senator Hassan from New Hampshire, a great leader on all of these issues.
Well, I appreciate that very much, Senator Markey, and I appreciate everybody's indulgence because they just did call votes, and I bet Booker's already voted.
I did.
All right, so I will turn it over really quickly, but I'm particularly grateful to Nicole Kle for being here, and obviously, in New Hampshire, a strongly pro-choice state, the live free or die state, we are already feeling the impacts of the Trump administration's attack on Title X funding. We've heard from clinics in New Hampshire that are considering plans to suspend their family planning services due to insufficient funding. These closures will exacerbate what is already an existing lack of reproductive health care in rural regions of our state. So, Nicole, can you tell us about the women's healthcare deserts that we're already seeing them in New Hampshire? What services are at stake for women who live across New Hampshire as a result of President Trump's actions to defund Title X?
Yeah. Well, first, thank you for your incredible leadership and support of the work that we do. We're lucky to have such strong representation for Northern New England. The question you ask is a critically important one. As I referenced in my testimony, we've had to close 6 health centers in the past 3 years, one of which was in New Hampshire, and the other one was on the border in Vermont. And both of those provided critical access in areas where there really isn't any other access to care. When we look at New Hampshire, especially when we look at northern New Hampshire and northwestern New Hampshire, we know that there are people foregoing care, and we're doing the best we can with the limited resources we have. We try through telehealth to make sure that we're available to those patients. But, the most difficult thing that I've had to be involved in is the decision to close a health center.
Yeah.
It is devastating because I know what the consequences are. I know that the health outcomes for that community are going to get worse. And I know that that's the reality for the past 3 years of what we've had to do. But, the insufficient funding, which has now been coupled with these attacks in Title X and the most recent defunding, make it, the intention is clear, to make it as impossible as it can be for us to provide care in a state that's incredibly pro-choice.
Yeah.
I wish I could say that I had answers. We are doing absolutely everything we can in this moment to make sure that we can continue to see the patients we're seeing in New Hampshire and across northern New England. But I can't promise that that's something that's going to be the reality a year from now.
Right. And this has been, and I will yield my time and go vote, but this has been the reality for some time, even before this current administration, while I was governor, the attempts to take away funding, for instance, from Planned Parenthood, and then say, don't worry, that women will get care elsewhere. And I literally said to a whole group of executive counselors, where exactly would that be? Yeah. And they said, don't worry, other doctors will do it. Just a heads up, today in the Help Committee, we heard from a nominee to be Assistant Secretary for Health at HHS, Dr. Christine, a distinguished surgeon by all accounts. But when I asked him whether he believed that women should get free cervical cancer screening, which is something, of course, provided at our Title 10 clinics, he would not answer the question. And he just repeated that Title 10 money can't be used for abortion. And I said, and it isn't. And he would not, and that's 460,000 women get free cancer screenings at Title X recipients around the country. So this is a full-out attempt underway to really roll back all women's health care in all settings that have been accessible and life-saving for women. So thank you for being in the trenches. We look forward to continuing to work with all of you. And Senator and Representative, thank you again for the opportunity, but also for your leadership here.
Thank you, Senator Hassing. Thank you for your great leadership. What I'm going to do right now is I'm going to ask some questions because I have to make the roll call, then hand it over to Congresswoman Fletcher, okay, to then recognize the members for their questions. So recently, my Republican colleagues voted to pass the largest health care cuts in American history. 17 million people could lose their insurance. 51,000 more people could die per year, according to Yale and University of Pennsylvania. There'll be 500,000 people in a decade because of those cuts. Hundreds of clinics, hospitals, nursing homes could close or cut services. And I'm proud that Massachusetts is a leader in the fight to protect and expand reproductive care, but Donald Trump and Republicans in Congress just made that fight even harder. Because it turns out Republicans only like states' rights when it's their right to interfere with people's freedom. So, Ms. St. Germain, can you tell us how federal policies are impacting protections for reproductive care in Massachusetts?
Yeah, absolutely. We know that these Medicaid restrictions and cuts are going to take a devastating toll on patient care in protective states like Massachusetts and beyond. We know that clinics suffering, shortfalls will be forced to make impossible decisions, whether that's reducing hours, laying off staff, in some cases ultimately closing their doors. Planned Parenthood has put out some statistics showing that they expect 200 clinic closures or more in the next few years, and 90% of which of those would be in protective states like ours. And that's Planned Parenthood. There's also independent clinics across the country that are going to be facing a similar fate. We know that a lot of people, as Nicole had mentioned in her testimony too, this is the only place where they go for healthcare. And this is going to have a devastating impact not only on reproductive health, but also on healthcare more generally across our state and across our country. We know that patients are going to face longer waits, more expensive care, in some cases denials altogether. And in Massachusetts, we know that in addition, 250,000 plus people are going to be losing, Medicaid access, leaving thousands of people without access to critical contraceptive care. But the antis are really focused on chaos and confusion. And this is going to cause a lot of confusion across our state and across our country. And I just want to plug that if anyone does ever have questions about their legal rights to be able to obtain care, Reproductive Equity Now has an abortion legal hotline. We do abortion, we do contraception, we do the full spectrum of reproductive health care, to give that number a call.
Thank you so much. Dr. Wilkinson, we've heard a lot today about the right to contraception under attack. Tell us more about the consequences. What does it mean for your patients when they don't have access to contraception?
Yeah, so when you take away people's ability to decide if and when to become a parent, all the outcomes downstream from that start to worsen. So my state has some of the highest infant and maternal mortality rates, and we anticipate that as contraception gets harder and harder to access, that those rates will worsen. Furthermore, there are a lot of disparities in those rates when you look at race, income, and geography. And so those disparities are just going to become more devastating for the communities in my state, but in communities everywhere as these cuts are nationwide.
No, thank you. And let me finish up by just asking a question of each of you. Dr. Wilkinson, will limits on reproductive freedom hurt your patients in Indiana?
Absolutely.
Ms. Keane, will the failure to pass the Right to Contraception Act hurt people in Virginia? Ms. Arvayo, are state-level restrictions on reproductive freedom combined with Trump and Republicans in Congress making it harder to get care, hurting people in Texas?
100%.
Ms. Kle, will Donald Trump and Republicans forcing Planned Parenthood to close make it harder for people to get health care in Maine and New Hampshire and Vermont?
Yes.
And Ms. St. Germain, will Donald Trump and Republicans' health care cuts hurt people in Massachusetts?
No doubt.
No doubt. So I think that it's conclusive, what is unfolding, and it's only accelerating because of those huge cuts that they passed last week. So let me thank you all for being here. I have to make the roll call, but I cannot thank you enough. I'm going to turn it over to Congresswoman Fletcher to continue the hearing. Thank you.
Wonderful. Thank you so much, Senator Markey. And again, thank you to all of our witnesses who are here. I have a few questions, and I think we will alternate between House and Senate. So, Senator Booker, you are on deck after my questions, and then Representative Chu, we'll go to you, and then we'll go to this side of the room and go in order. But I already mentioned in my opening remarks how much I love my home state, how proud I am to be a Texan, and at the same time, how Texas has been, unfortunately, a testing ground for a lot of the attacks on reproductive freedom. And one example recently is the Deonda case that forced minors in Texas to receive parental consent when seeking birth control and access to birth control at a Title X clinic. And so I really want to talk a little bit, Ms. Arvayo, and direct kind of some of these questions to you. But for those who don't know about this decision, essentially, I mean, I guess it speaks for itself. You have to get parental consent to get birth control. And, you know, before the ruling, Title X clinics were one of the only safe spaces for teens to receive reproductive health care without parental consent. And in a survey, I think 1 in 5 said they wouldn't try to get that care if their parents would find out. And so I just want to start by thanking you for the incredible work that you do and that Jane's Due Process does in Texas for young people in Texas. And I've known the organization for many years and just cannot overstate how important your work is and how incredibly helpful it has been to so many Texans. So can you just talk a little bit about the immediate effects you've seen from this parental consent requirement and more broadly the changes you've seen in the last couple of years in the communities that you're serving?
Of course, and I also just want to first start by saying we are so appreciative of your championship, Representative Fletcher. And this time, it cannot be overstated how important it is for young Texans to see that they really have people in Congress from their state that are fighting for them. So thank you so much for your work as well. And I think the first thing that I want to say about the Deanna decision is that, while respecting religious beliefs is, of course, undeniably important, this is not about religious freedom. It's about giving one person's belief the power to strip others. The reality that one father's personally held beliefs could dictate public policy for an entire state of people is devastating for a lot of reasons, but particularly for young people. And the result is that teens who can't talk to their parents or who live in unsafe or unsupportive homes are now being denied access to contraception entirely. What that means for young people is not only having to put their lives on pause, being faced with the reality of they might not be able to continue to go to school. They might not be able to continue down the career options that they wanted to. They have to upend their life just to be able to access care that's unavailable in their community. It cannot be overstated how devastating that is for young people in Texas. We can and must protect both freedom of belief and the rights of young people to make informed private decisions about their health. And it's important to state that when we talk about restricting these rights for young people, we're not just talking about abortion access, we're not just talking about birth control, we're talking about gender-affirming care and really the full spectrum of reproductive health. And we know that what starts with young people does not end with young people. They're often used as just the starting ground for what anti-abortion extremists can push everywhere for everybody.
Thank you so much for sharing that, and again, thank you for your work. I think, to your point, we're seeing some of these same challenges in Texas, as I mentioned in my opening, of Texas trying to exclude Planned Parenthood centers from our Title X, our Texas version of Title X and Medicaid funding. And so with the reconciliation bill that unfortunately passed over our objections and despite our best efforts, Ms. Kle, can you just talk a little bit about what the impact of losing those Medicaid dollars will mean for your Planned Parenthood health centers, but also Planned Parenthood more broadly? I know the statistic many of us mentioned in the debate was that there are 2 million Americans that rely on Planned Parenthood every single year for access to reproductive health care.
Yeah. First, thank you for the question. And maybe if you'll allow me, I'll take a step back first, which is talk a little bit about what Planned Parenthood is and what we do in a community. So Planned Parenthood of Northern New England is going to turn 60 this year. We have touched the lives of more than 1 million people across our region in Maine, New Hampshire, and Vermont. When I say that we are a part of the community, we are embedded and have deep ties across generations of people who live in our region. We've saved lives, countless lives. It is baffling, it is gut-wrenching that we are having to navigate the types of attacks that we are having to navigate today. And I say that as someone who's dedicated my life to this work, but also someone who hears every single day what the impact is that we have on an individual and their life. We hear, we have something that's called the doorknob moment, which means that as the visit concludes and the clinician reaches for the doorknob, that's really when the patient opens up for us. And that's when they share, you know what, I don't have a safe place to go. I can't afford to feed my kids. These are the conversations that we are having. This is the work that we are doing with people in our region and across the country. The idea that we are being targeted because we provide abortion care, which is legally available in our 3 states, is outrageous and should make everyone really, really mad. The consequences of the defunding and the loss of Title X funds are going to be deep, and they are going to dramatically ripple through our country and change the health outcomes for women, not just in this generation, but for generations to come.
Well, thank you. That's really sobering, and I've gone over the time that I was allotted, so I didn't get to everyone, but hopefully all of you being here, I appreciate you, and we will get to all of you with different questions. And so the next person I'm going to look to for questions is, of course, Senator Booker. Thanks so much, Senator Booker.
No, thank you for holding this hearing with Senator Markey, or I should say Maki. And it just means a lot to me as a friend and a champion and somebody who inspires me in this work. I'm just grateful to be here with you today. And whenever you get the House and the Senate coming together, it's crazy things happen. But I'm really grateful. And the champions that are around me at this table are extraordinary. I'm humbled by each and every one of you and your commitment day in and day out at a time that we're seeing an unprecedented assault on women's reproductive freedom, unprecedented assault on bodily autonomy, and to me, some of the fundamental values of our country. Senator Patty Murray and I are working on an aspect of this I'd like to get into in the very limited time that I have, which is really access to birth control. We introduced today the Access to Birth Control Act, and there have been reports across this country that pharmacies are refusing to fill prescriptions for birth control or provide emergency contraception in over half of the states in the nation. This is frightening to be someone who would go for this critical, what I believe is a right, and not to have those prescriptions filled. 7 states, Arizona, Arkansas, Georgia, Indiana, Mississippi, South Dakota, have laws or regulations that explicitly allow pharmacies or pharmacists to refuse to provide contraception to patients based on their own beliefs without providing critical protections for those patients, such as requirements to refer or transfer prescriptions to another pharmacy. And we know, when you're talking about some rural areas, how far that other pharmacy might be and how much of an imposition that might be on someone. And so my bill, along with Patty Murray, the Access to Birth Control Act, would put a stop to these refusals and guarantee patients timely access to birth control. I just want to explore that a little bit, and maybe Ms. Wilkinson, you practice medicine in one of the 7 states explicitly that explicitly allows pharmacists to refuse to fill prescriptions for birth control. I want to know if you can tell me a little bit more about how pharmacies' refusals have affected your patients and why establishing a federal standard for access in these settings is essential for public health.
Thank you, Senator Booker, for introducing that bill. I do work in a state that has the ability for pharmacists to refuse to fill prescriptions. And just last month, I was on the phone with a pharmacy trying to advocate for a patient to get her prescription filled and fighting with a pharmacist to literally just give the medication in a timely manner. And I felt grateful that the patient reached out to tell us that this had even happened, because I know there are also countless of patients that don't call our clinic to let us know that they weren't able to get the medication that we discussed because they went to the pharmacy and were told no. It would be incredibly helpful to have federal protections in place to help pharmacies all over the country provide the care that our patients deserve in a timely manner.
Thank you very much. And Ms. Key, maybe you can maybe talk about the fact that your organization operates in states where there have been documented instances as well of pharmacists refusing to fill birth control prescriptions. Can you talk a little bit about how pharmacy refusals are obstructing access to birth control and how we can fix that?
We do want to make sure that people's religious beliefs are respected, but we also want to make sure that our rights don't end where someone else's begins, and there has to be a balance. And what we have seen some refusals through the years. We've tried to, some of our providers, our doctors, our nurse practitioners, our some pharmacists who are with us have certainly worked to make sure to find that balance when it comes to providing care. But we simply can't take away someone's decision to access the medication and the health care that they want and they need to decide, their futures, their destinies. It's disrespectful. It's also discrimination, and we really need to work. So your bill is going to help us do that when, at some point, it will pass. I'm sure of it.
I want to thank you and everybody here again. We're in a sobering time in our country. This refusal that many pharmacists have the power to do of critical care, the attack that we've seen from Dobbs, the attacks on providers like Planned Parenthood, all of this comes to a moment, I think, in our country of moral urgency that all of us have to understand that nothing is going to change unless we get involved in this fight and this push. I'm grateful for my colleagues in the House. I'm grateful for all the leadership that's here today. I'm a prisoner of hope. We will be able to make a difference. I know that we can, and I hope we will not give up. Thank you.
Thank you so much, Senator Booker. And I have to say, I'm amazed that you can tell exactly what 5 minutes is. It's like perfect timing. So thank you so much. We are now I'm going to recognize my wonderful colleague and a true champion, Representative Judy Chu. And also, because we're alternating House and Senate, just want to let Senator Baldwin know you're on deck for the next questions. Thank you.
I'd like to thank all the witnesses for being here today. In this moment, we're facing one of the biggest threats to reproductive health care that we've ever faced. So your work is so critical as we fight back against these attacks. President Trump and Republicans' big ugly bill is one of the most extreme and dangerous pieces of legislation in our country's history, kicking 17 million people off their health care, ripping food assistance from millions of families, all to give billions of dollars of tax cuts to the rich. And what is even more disturbing is that buried inside this nearly 1,000-page bill is a provision that strips Medicaid funding from Planned Parenthood centers across the country. And Republicans started with 10 years of defunding for Planned Parenthood and then reduced it to 1 year, but Ms. Clegg, in your testimony, you highlighted that even a single year of defunding Medicaid reimbursements to Planned Parenthood could force up to 200 clinics to close. And as the chair of the Reproductive Task Force for our Congressional Reproductive Freedom Caucus, I find it deeply disturbing that what could happen is that the damage will be done. Centers rarely reopen, the staff leave, the patients are left with nowhere to go. And at a time when abortion is already banned in much of the country and birth control is under attack, this provision would rip care away from 1 million patients. But I'd like to hear from you, your perspective of what even just 1 year of defunding would do.
Thank you for the question. And I think it's important to also name that there are lots of terrible things in this bill that are going to impact people's health. This is the thing that happened first. It happened on July 4th when President Trump signed the bill into law. We were lucky to immediately go to court on Monday, and we have been successful in receiving a temporary restraining order, but that expires in 14 days. So we don't know what the future holds for us. We have been, honestly, we are in meetings all day long to try and figure out how we maintain as much access to care for our patients who are insured by Medicaid. And that is our commitment. We're going to do everything we can to save as many of these people as possible. But I know that we're not going to be able to make up the difference. And I say this operating in 3 states that are incredibly supportive of reproductive rights. We are fortunate to have the representation we have. But we also operate in rural states where it is hard. It is hard to attract the medical providers that we need. It's hard to, provide care in, areas of the country where people are, they don't have transportation. They can't get to us. Maybe they have to drive an hour. It's really hard. I think, it's not 10 years. It is 1 year. That 1 year is going to cause harm. Like, there's no question in my mind that, women are going to lose access to care. And it's going to present in different ways in different parts of the country, but we're all going to feel it.
So I represent California's 28th district, and in California, we uphold reproductive freedom, and abortion rights are constitutionally protected. But Republicans' big ugly bill could force the Planned Parenthood in my Los Angeles area district to close, and as a result, thousands of Californians who rely on Planned Parenthood for everything from birth control to HIV could lose their care. And some people say that what this amounts to is a backdoor national abortion ban, even in a state like mine. Mm-hmm. What do you say to that, Ms. Clegg?
You are absolutely correct. This is the whole reason why we're being targeted, is to go after an organization that is committed to making sure that we provide comprehensive reproductive health care that includes abortion. That is the only reason that this language is in that bill, is so that they can make it harder. They can make it harder for us to provide abortion. They can make it harder for people to access abortion in states where it is legal. Because let's be clear, it was never about returning this to the states. It has always been about banning abortion across our country. And this is the goal.
And let me point out that that not every provider actually accepts Medicaid, but Planned Parenthood does. And can you talk about the fact that Planned Parenthood does accept it, and how significant is that?
Yeah, so we have a commitment to see everyone, regardless of ability to pay. Whoever walks through our door, they're going to get high-quality, exceptional care, including those who are insured by Medicaid. And we know because Medicaid reimbursement rates aren't great in many parts of our country, other providers just don't see them. So, people have a guarantee from us. They come through our doors, they're going to get care, whether they have insurance or not, or if they have Medicaid. I think that, again, this attack is going to be incredibly disruptive for people who are insured by Medicaid, who are the lowest income in our country.
Thank you. I yield back.
Thank you so much, Representative Chu. And another champion, this is a room full of champions, Senator Baldwin.
Thank you so much, and I really want to thank you and Senator Markey for hosting the Spotlight hearing on access to contraception and the right to contraception in a post-Roe era. I I wanted to mention a couple of things about the Dobbs decision and then ask some questions from the perspective of someone who represents a state that doesn't have the same protections for reproductive freedom that others do. But first, observations about the Dobbs decision. You know, the Dobbs decision looked back at the underpinning of Roe v. Wade and basically said they can't find a constitutional right to privacy. And so I was, I'm a lawyer. I haven't practiced law in a long time, but I remember my law school days of thinking about the right to privacy and thinking about all the other decisions that were based on a right to privacy, including a whole long line of contraception cases, including Lawrence v. Texas, including same-sex marriage and interracial marriage. And while the majority opinion didn't say that having found that there was no constitutional right to privacy, that they were going after all the other cases, Justice Thomas, in his dissenting opinion, or his concurring opinion with the majority opinion, said, perhaps we should revisit those. Mm-hmm. So, you know, we may be at some point looking at the Supreme Court, looking again anew at our right to access contraception. But in the meantime, the Dobbs decision basically said there's no longer a law of the land, it goes to the states. And in my state of Wisconsin, for those who didn't follow with granular detail, we had a law that was passed in the year 1849. Wisconsin became a state in 1848, so this was, within the first year of statehood, they passed a law that was widely read as a criminal abortion ban. And so the day that Dobbs came down, there were no services in our state for, it was about 15 months. And then a trial court in Wisconsin reviewed that a challenge to the 1849 statute and said, boy, I don't think the legislature back then meant that to apply to abortion. I think it was a feticide statute. And that opened the possibility for services to be provided in that county where that decision was made, and also in two other counties where both the district attorney and sheriff agreed not to arrest anybody so there were 3 counties out of 72 that provided any services in Wisconsin. Now, there's a great news in our struggle. The Wisconsin State Supreme Court invalidated that 1849 statute just a few weeks ago. Elections matter. We do elect our state Supreme Court justices to 10-year terms. But in any event, this has taught us a lot about how our rights vary depending on zip code, on county, on state. And that should not be the case for anybody, that their rights vary. So we're talking today, several bills, Senator Booker's Access to Birth Control Act, Senator Markey, Hirono and Duckworth's Right to Contraception Act, the Senator Fetterman's Convenient Contraception Act, and then there's several others out there. What does codifying at the federal level, this is a softball question, having laid the groundwork with the state by state, but what does having this codified at the federal level mean for the integrity of our reproductive freedoms moving forward?
And I'm happy to start as somebody, coming from a state of Texas that unfortunately, unlike Wisconsin, would not make a move like that. Immediately following the Dobbs decision, all abortion funds in Texas received a cease and desist letter from Attorney General Ken Paxton instructing us to stop our work. We had to pause our work from June 2022 when it was passed until May 2023 when we were able to reassert our right and ability to help Texans travel out of state for care. We know that without federal protections, Texans are going to be left in the dark when it comes to their reproductive rights. Our state government, our state courts, our state Supreme Court are all going to fall in line with President Trump. So unless we have protections at the federal level, Texans are always going to be subject to the whimsy of the anti-abortion extremists at both the state and federal government.
Yeah. I mentioned, by the way, all the wonderful legislation that we have on protecting the right to contraception. I should just note that I'm one of the leaders, well, the lead author of the Women's Health Protection Act, which would codify Roe at the federal level. And we introduced it recently with every member of our Democratic caucus as a co-sponsor.
That's great. Thank you so much, Senator Baldwin. I know we've gone a little over time, and we have a few people we're trying to get in. We were going to end at 2:30, but I think we're going to go a little longer so that our other colleagues can get in their questions. But thank you so much. And of course, speaking of the Women's Health Protection Act, I want to thank Representative Judy Chu, who's the lead House sponsor, and has just been so great at moving that through the House with a huge coalition of support from the House Democratic Caucus. With that, we're going to go a little bit out of order to accommodate some schedule requests. So Dr. Kelly Morrison, you are up next.
Thank you, Congresswoman Fletcher, and thanks to you and Senator Markey for convening all of us. And thank you so much to the witnesses for being here today. Hearing your stories it makes me angry and it's heartbreaking, but it's also such a reminder that there are so many good people and organizations in this fight together. So thank you for your work and thank you for being here too. I'm new to Congress. I'm in my first year of my first.
Feels longer, doesn't it?
It's been quite a 6 months, let me tell you. But I come to Congress as the first and only pro-abortion rights OBGYN, incidentally. But also I spent 6 years in the Minnesota State Legislature. So I am very aware of how important these conversations, these coalitions are to pushing back against some of these horrible excesses that we're seeing from this administration. And the attacks that we're seeing on contraception and access to it and on reproductive health care in general are devastating. My time as a state legislator began after being a practicing OBGYN for nearly 20 years. And what really compelled me to jump into the role of legislator was my concern for what the first Trump administration would mean for reproductive health care across the country. And as the only OBGYN in the Minnesota legislature, I was really proud to help lead the effort to protect and expand access to reproductive health care, including abortion care, in the wake of the Dobbs decision. So coming from that background, I'm so grateful for the work that your organizations are pursuing and for being here today so that we can strategize together. I am honored to serve in the House with 5 other Democratic doctors, and we just formed the first ever Democratic Doctors Caucus. And one of the things that we're really focusing on is working on combating misinformation, which is coming at us from so many different directions, and now also from the administration. The first thing we did was hold a press conference to explain our opposition to the nomination of Robert F. Kennedy Jr. to lead HHS. I think about all of the attacks that are coming at access to reproductive health care. We also are dealing with misinformation and campaigns to sow doubt about the safety and health of contraception. So I would be so curious, and it's directed at any one of you really, maybe especially you, Dr. Wilkinson, but all of you. What are the things that we can do to combat those campaigns and that information, and what should Congress be prioritizing to ensure that patients have access to accurate information?
Thank you so much for that question. I want to echo what you're saying, that the misinformation is the point. Yeah. It is one of their tactics. Yeah. And they are trying to sow misinformation so that people are confused and they don't know who to believe. Mm-hmm. And so I think one of the things that we can do is to stand firmly and clearly behind something like birth control and be very clear about what it does and what it doesn't do. Mm-hmm. And so birth control does not end a pregnancy, full stop.
Right.
And we don't need to say that anymore. We don't need to say anything more than that because the other side is trying to say all the opposite things. But that's what the science says. And I think if we align ourselves with the science and are very clear, that our message will be louder.
Yeah, thank you. I know time is short. I have so many other questions, but I'll pause there. But I just want to offer an invitation to please reach out to me at any time. I would be so honored to work with any and all of you on legislation or any of your campaigns. So thank you so much.
Thank you so much, Representative Morrison. And next, we will hear from Congresswoman Becca Balint, followed by Congresswoman Goodlander, and then Congresswoman McClellan to close us out today.
Thank you so much, Representative Fletcher, for having us here. Certainly, thank you to all the witnesses. I know how precious your time is, and it matters that you take the time to come here. I just wanted to start with something that was said earlier. I just want to shine a light on it. We have been told over and over and over again that we are exaggerating, that we're being hysterical, that we don't know what's coming. And I was the majority leader in the state Senate in Vermont, and then later the president pro tem, and we codified reproductive rights in statute, and we codified it in our state constitution. And every step of the way, I was dealing with people within my own caucus, and certainly people on the other side of the aisle, that told me, why are we wasting time on this? This is never going to happen. The Supreme Court is never going to overturn Roe v. Wade. And we said, you are not paying attention. And so I just want to acknowledge that we know in here what the mission is that they are trying to achieve, and we cannot lose our focus because they're going to tell us every step of the way, you are exaggerating. They're not actually going to try to take away all of the rights to control your own bodies. And that's just not true, because they're showing us in every possible way that that is actually exactly what they're intending to do. So I just want us to step fully into that power and that knowledge, that we are clear-eyed in that vision. So to that point, right, reproductive rights are so important to all of our constituents, regardless of party, regardless of whether they live in an urban area or a rural area, and we need to stand up for them. And the Republicans' ultimate goal has been to criminalize reproductive health care and to make it as hard as possible for people to get access to it. And we had Senator Baldwin speaking earlier to the fact that you have 25 million women right now already living in states in which they can't get the access to care that they need and deserve. And they're coming for the rest of the states where we have been very proactive in making sure people have those rights. So I want to just jump ahead because I understand that we're pressed for time here. I want to just talk really quickly about how this impacts people in rural areas in ways that other people do not understand. And so I represent Vermont. It's overwhelmingly rural. Most of the people in my state live in towns that are populated under 2,500 people. Okay, we have the most towns under 2,500 people. Nicole Kle, can you just talk about what does it mean when you have to close a clinic in rural Vermont? Yep. What does that mean for those women and those families?
Well, I mean, thank you for the question and making the point that you've made about the reality of this moment. You know, earlier this year, we had to make the very difficult decision to close a health center in St. Johnsbury. For those of you that aren't familiar with Vermont, it's located in the northeast part of the state. It is incredibly rural. It's also struggling with very serious issues around poverty and substance use disorder. And we knew when we were closing our doors that we were closing our doors on that community and nobody else was going to be there because of our commitment to see everyone regardless of ability to pay, you know? And because it's easy to point, well, there's a doctor down the street, but I'm like, that doctor, one, doesn't have the appointments available to absorb what we're closing, nor are they going to be providing care for free.
That's exactly right.
And that's what we do. You know, it was extraordinarily hard. It's still a weight I carry with me. I wish I could solve this problem. I can't do it by myself. It's something that, you know, we're all going to have to do together.
And then those patients still need care.
Yeah.
Right?
Yep.
And so we're looking at the geography of Vermont. You have now people who maybe have already driven an hour to try to get to St. Johnsbury, and now that's closing. So they're going to have to drive another hour, maybe an hour and a half, to get to a clinic. And so what Republicans fail to admit and again, it is misinformation, it's intentional, is that a ban on Planned Parenthood, right, for Medicaid dollars is going to impact so many more women than they are being honest about. So a recent study by the Guttmacher Institute shows that other publicly supported clinics in Vermont and New Hampshire would have to increase their caseloads by 100% to fill the gap. It's not going to happen. We don't have the providers, and many of those providers will not take Medicaid. And so it's all smokescreen. And so let's just be clear. This is about them not giving a damn about our physical health. They don't care who they have to hurt. They are going to see this through to the end, where most women in this country will be denied the health care that they need and deserve. So thank you so much for being here. I wish I had 10 more minutes to talk about all the work that I've done, but I'm with you in the fight.
Thank you so much, Representative Ballant. We are lucky to have you in the fight and grateful for you here today. Now we'll turn to Representative Goodlander.
Well, Congresswoman Fletcher, thank you so much for bringing us together today, you and Senator Markey. Senator Booker said that things happen when the Senate and the House get together. I think this is just the kind of good trouble we should be getting into together, and I'm grateful to everyone for being here today. Grateful to be next to my neighbor in Vermont for this important discussion with two incredibly important organizations, Nicole Kle, Planned Parenthood, Reproductive Equity Now, Taylor St. Germain. Thank you so much for being here. Thank you for what you're doing for the state of New Hampshire. You know, in the last couple of weeks, I'm new here too. I'm 6 months in, it's been a long year. And one of the things, you know, Congresswoman Morrison mentioned it, just the level and the depth and the breadth of the misinformation. As a very proud patient of Planned Parenthood, you know, as a person who, when I was serving in the Navy, relied on Planned Parenthood for a cancer screening in order to maintain my medical readiness, I serve on the House Armed Services Committee, and I had an opportunity recently to educate one of our colleagues about what Planned Parenthood actually does. And I want to give you this chance because I was astonished by how little, just how deep the misunderstandings are. You know, the Planned Parenthood health centers that I visited as a patient, as a congresswoman, what I see there, mission-critical, life-saving cancer screenings, a lifeline for vaccinations that wouldn't be available to people anywhere else, contraception. The list goes on, but I want to give you this chance because Planned Parenthood is a truly misunderstood institution among so many of our colleagues here in Congress. So what does Planned Parenthood do for America?
Well, thank you for the question. There's nothing I like to talk about more than the incredible work of Planned Parenthood. You know, we are a full spectrum, comprehensive sexual and reproductive health care provider. What does that mean? That means that we are treating people for UTIs. It means that we are treating people for menopause and perimenopause. It means that we are providing vasectomy care.
I was going to say, that's actually something that many men don't know.
Yes. Well, although we do have a nice, healthy waiting list. You know, we provide people with their flu shots. We are often, you know, people forget or don't think of us as like this front line in the context of public health. When there is something emerging, like COVID, our doors stay open. We provide acute, time-sensitive care. You know, so we're sitting on the front lines in so many ways when it comes to access to reproductive and sexual health care and some primary care, like you get your flu shot with us. You know, we provide behavioral health care, which we've seen an increasing demand for because there's just so much people are struggling with right now, whether it's food insecurity or, you know, they're in a violent situation at home or they've experienced sexual trauma. You know, we have somebody in our health center when they disclose this that we're able to walk them over to get that type of care. It is so much more than abortion. And while abortion is critically important, and I am so proud that we are an abortion provider, it is just a piece of the full story that we tell.
Well, thank you for that. You know, on this bill, on H.R. 1, the big, brutal bill, there's also, we have a lot of low information voters who voted on that bill in the United States Congress. And one of the provisions that just shocks the conscience, and you pointed it out in your written testimony, Ms. Kle, according to the Congressional Budget Office, it's costing the American taxpayer $50 million in order to carry out this completely pernicious provision that's going to prevent Planned Parenthood from participating in Medicaid. So this is the cost of the taxpayer up front. But you mentioned St. Johnsbury, and that health center was a lifeline for northern New Hampshire, for the North Country of my state. The impacts, I just wanted you to say a little bit more about what this is going to mean for patients in the short term who are going to be hurt, and what it means for providers like you, and how you're going to make the additional decisions. You use the word devastating, and there are only two words I hear to describe these cuts. It's devastating and catastrophic.
So, I mean, yes, St. Johnsbury sort of sits on the border. So that closure hit two states, because people who live in states don't make healthcare decisions based on a state boundary. I think what is, there are so many pieces here, and certainly we're doing our best in terms of promoting our telehealth and trying to make it as available as possible. But that's not a substitute for in-person visits. Folks that live in rural states really understand how critically important transportation is. Mm-hmm. And if you're low income, you may or may not have a car. You may or may not be able to get to what is, the nearest health center that's available. And as was made very clear, there aren't other healthcare providers that are picking up the slack in our states. It's when these doors close, they are struggling to find us. And, in addition to transportation, it's important to remember that a majority of our patients are parents. Mm-hmm. These people also have to find childcare to come to us, in addition to transportation and time off from work. So it hurts. It hurts your state. It hurts those communities. In my dream, we come back, but under the context that we're living in right now, that is far out of reach.
Well, we won't stop working towards it. I know I'm out of time. I just wanted to ask you, you mentioned, Ms. St. Germain, right now we've got to know our rights. We've got to know the rights we have, the rights we don't have. You mentioned a Know Your Rights hotline. I just want to get the number so that I can share it widely with my constituents.
Gosh, I'm going to get that to you via
Good.
email. Because it is.
We'll spread it out widely.
I can't remember off the top of my head, but you can also go to reproequitynow.org/hotline. And you can either call, there's an online form you can fill out that is safe and secure and confidential, because we know how important digital security is when it comes to our movement right now. But that is a Know Your Rights hotline. We connect with access calls all the time, and we also connect folks with pro bono legal support.
Well, thank you so much. Thank you again.
Terrific. Well, thank you so much for that. And of course, I am thrilled to be able to close this important hearing with questions from one of my favorite colleagues from Virginia, who I serve with on the House Committee on Energy and Commerce. And every time she asks a question or stops to explain things to our friends on the other side of the aisle about just what they're getting wrong, it's incredibly powerful. It's incredibly meaningful. And as a former Virginia State Law School student, former Virginia non-resident for 3 years, I am just so thrilled to work with our fabulous representative from Virginia, Jennifer McClellan. So we'll close with you.
Thank you, Congresswoman Fletcher. It is a privilege for me to also serve with you, particularly to be in leadership on the Reproductive Freedom Caucus with you, where I chair the Abortion Rights and Access Task Force. But as you heard before, I came to Congress in a special election in 2023. I served in the Virginia State Legislature. As a matter of fact, we're coming up on the 20th anniversary of when I was elected. But before that, I was a college student who had very painful ovarian cysts, who needed birth control to help regulate my periods and just make the pain go away. And then I became the first member of the House of Delegates to be pregnant and give birth while in office in the over 400-year history of the oldest continuously serving legislature in the United States. With my second child, I almost became a statistic of one of the Black women who are 3 times more likely to die in childbirth or from childbirth-related issues in this country. As my daughter was born 9 weeks early, and we both almost died. Both of my pregnancies were geriatric pregnancies. I hate that term, but my second one was high risk. And after that, it became very clear to me I did not want to have any more children. I was 42 at the time. But in my family, our reproductive age is surprisingly long. And so I sit before you now as someone who has an IUD because if I get pregnant again, I could die. So the idea that as a college student, as someone with a high-risk pregnancy, as a 52-year-old woman who has an IUD, that a pharmacist could decide, I'm not going to give you the health care that you need because I morally disagree with your choices. The fact that politicians in Richmond or in Washington could say, I know better than you and your provider what decisions should be made, whether it's in an unplanned pregnancy or a planned pregnancy, galls me. And the fact that I am the first generation of my family to lose a constitutional right in my lifetime, and that my daughter, who I nearly died giving birth to, may not have the same peace of mind when she reaches childbearing years that I had when she was born, infuriates me. But in my time in Virginia, I was proud to work with Terrina Keane and a very strong coalition of reproductive freedom advocates and storytellers. And the power of storytelling is how we were able to achieve the successes that we achieved and how we are fighting back against what is happening now. But Ms. Keane, you talked about in your testimony how important about the constitutional amendment in Virginia, which I began that fight as a state senator and am proud to see my colleagues carry it forward. But it's not just a fight for the right to make your own healthcare decisions. Can you talk about how important state constitutional amendments now are to protecting comprehensive reproductive freedom?
Absolutely. Well, we know, unfortunately, because of the Dobbs decision, thank you, that we can no longer rely on the courts to protect our rights. They're actually, their new posture is taking our rights away. And our own governor just this past year, or just a couple of months ago, vetoed 2 birth control bills, basically saying that we already have the right based on 2 other Supreme Court decisions, the Griswold decision and the Eisenstadt decision. And we know that those were based on the same, legal decision from Roe v. Wade. So we can no longer rely on the Supreme Court or any court. So we need to make sure that we are explicitly putting our rights into the code, and we're also explicitly putting them into the Constitution, so there is no doubt what our rights are, but we also need to unequivocally guarantee access to care too. Also, Roe guaranteed us the right for almost 50 years, but that did not mean that we had full access to abortion care. And that's the same thing goes for contraception and birth control and the full range of reproductive health care right now. So I think that what we're doing in our states is we have to do that because we do not have the federal right to any of these services, and we know that they're under threat. Every minute that President Trump is in office, and that there is a trifecta here on the Hill. So hopefully what we can do every day, we're fighting in our states like Virginia, Some people call us a purple state, some people call us a light blue state, but whatever we are, I know that Virginians are with us. They want a constitutional amendment overwhelmingly. They want birth control protections, they want abortion protections, they want to be able to make their own decisions about if and when and how and with whom to start and grow their families without political interference. So that is what Virginia's very happy right now to be working on this. And we're following in the steps of many other states, but we hope that there are Democrats, there are Republicans, there are independents that are with us. We just have to get it over the finish line and get it to the voters of Virginia, and hopefully that will happen in November of 2026.
Well, thank you. Your constitutional right shouldn't depend on what state you live in, so that's why I'm proud to work with Lizzie Fletcher to fight this fight at the federal level, and I yield back.
Well, thank you so much, Representative McClellan. And thanks to all of our witnesses for being here today, for your insights, for your recommendations, for your clarity about what we need to do, what we need to be thinking about, and most important, for the work that you do every single day for the people we represent and people like them across our country. And doing the work that you do is protecting people not just here at home, but everywhere. And I'm so grateful to you. I also unilaterally extended our time, and we need to leave this room, so we unfortunately have to wrap it up here. And I just thank you all so much for being here and look forward to continuing our work together. Thank you.